Hi, I'm Dr. McCartin, a neuro-optometrist and owner of the Visual Processing Institute. In this video, I'm going to explain how a concussion, whiplash, or any other kind of brain injury could potentially cause a lazy eye. First off, I would like to clarify that I hate the term lazy eye. I don't like the term because it's generally used to describe or name two different conditions that can happen together, but can also happen on their own. The first condition is used to describe as amblyopia. This is when the brain-eye connection doesn't fully develop to a point where the patient can see 20/20, even when fully corrected with glasses or contact lenses. The other and separate condition that it's used to describe is strabismus. This is when an eye constantly or occasionally turns inward or outward and possibly even up or down and loses alignment. These two conditions can happen together, but they are individual and can also happen on their own. So this video is going to address the second condition that many people think of when they hear lazy eye, and that is a strabismus, or as I like to call it, an eye turn. So for example, this would be an esotropia, like that. So calling it an eye turn is more correctly descriptive. The eye indeed is turning and losing alignment. I often have people surprised when I say that I have a patient whose injury, brain injury, now gave them an eye turn. And that is simply because our general misconception about eye turns and strabismus. Before we had the information that we have nowadays on neurology and development, eye turns were first hypothesized to be caused by a muscle that is weak or attached in the wrong location, thus why surgery was recommended. But this hypothesis was never proven. It was actually never even capable of being tested, because in order to test the strength of a muscle, you must either take a biopsy and perhaps check the density. And to the best of my knowledge, no one has been sticking needles into thousands of children's eyes to obtain normative data. The other way to determine if a muscle is weak is to apply resistance. Now, this is easily done with any of our limbs, as we can simply add a weight. But for the eyes, the only way that I can imagine doing this is to put a hook through the white portion of the eye and have the patient look in the opposite direction as the hook so that it can apply resistance. Now, if that sounds crazy, that's because it is. And again, to the best of my knowledge, no one has done this. So we really need to dive into what causes a lazy eye. Now, this is incredibly important to understand in order to understand how a brain injury can indeed cause an eye to turn or strabismus. Now, we know that at some point in our life, it is perfectly normal to have a lazy eye or an eye turn, and that is in our infancy and early toddlerhood. This means we know that since it is normal during infancy and we have no actual evidence that those muscles are weak when the problem persists into childhood, teenage years, and adulthood, then the eye turn must be a result of a deficiency of a learned skill. Thus, why it is normal in infancy before the skill is learned. I like to tell my patients that every single 3-month-old, 5-month-old, 7-month-old, and probably any patient under a year old has a lazy eye. I like to call them googly eyes. They also have googly arms and googly legs, and no one panics about that because it is well understood that in order to neurologically guide the movements of our arms and legs in a coordinated and efficient fashion, it is a learned skill. But because we have evolved to have these external appendages that are our eyes, internally stored and safe within a skull and orbit, they are given a really raw deal and expected to just be operating flawlessly from birth. As I've said in other videos, and I say to just about all of my patients, our eyes are mindless little balls of jelly. They are as dumb as your hands. They require the same neurological guidance and coordination from our brain that every other part of our body does. So if your eye makes a mistake, the eye is too dumb to even make decisions. So it is really a mistake of the brain. So now that we understand that all eye movements are coordinated and caused by brain calculations and learned skills, it should be very easy to understand how these skills of coordinating the eyes can become damaged in the exact same way that any other skill can be damaged from a sustained brain injury. In my patients who have sustained brain injuries, the visual processing skills that developed from childhood are often damaged to a point where they have regressed back to that of a child or toddler. And I can measure and compare those numbers in my exam room. And if this sounds extreme, it really is not. We see this all the time when a patient gets a brain injury and now has a hard time moving their hands or moving their legs to walk. Essentially, if they have lost their knowledge of how to coordinate their legs and walk properly, then that skill has been damaged to that of a 1 or 2-year-old. We can appropriately send them to physical therapy to redevelop these neurological skills. So it should not be a stretch of the imagination or of our understanding of how these developed skills factually work and operate and develop over time, that in the same way that the skill to walk can be damaged, we must respect and acknowledge that the skills of processing visual data and coordinating the appendages that are our eyes, which are far more complex, can also be damaged. And this is how a patient can suffer from a lazy eye or eye turn, strabismus, after a brain injury. Given that your visual processing system requires just about every part of your brain, and it requires several parts of your brainstem to operate fully and efficiently, I cannot think of a side of the head that can receive impact that will not have an effect on the visual processing skills and won't end up resulting in them being damaged. And that obviously includes whiplash. I cannot fathom a whiplash patient not having a deficiency in at least one of their visual processing skills, because there are multiple visual pathways that travel down the brainstem and back up into the brain. The exact diagnosis and deficiencies that lead to eye turns in post-concussion, post-whiplash, and other brain injury patients are essentially extreme deficiencies in their resting position and posturing of their eyes, to a point where the patient cannot compensate for it 100% of the time. To give an example, studies have found that over 50% of post-concussion syndrome patients have convergence insufficiency, which is just one of the 20 known visual processing skills that we need to operate in order to do our best and have our highest quality of life. Convergence insufficiency is when your brain miscalculates space and does not send an autonomic response to converge your eyes to an appropriate location in space. There are different degrees of how poorly this calculation is performed, and if the calculation is slightly off, then a patient can pull their eyes in 100% of the time and make this very real and incredibly highly symptomatic and life-altering deficiency invisible to anyone who looks at the patient. If the miscalculation is off to a higher degree, which it normally is in brain injury patients, the patient is not capable of compensating 100% of the time. Any moment that the patient fatigues and cannot compensate, one of the eyes will stay locked on the target and the other will rest out. That has now, by definition, become an intermittent exotropia or strabismus, and sometimes commonly called a lazy eye. This miscalculation can happen at distance object or at a near object. It can be incorrect in turning the eyes in too much or turning the eyes out too much, or not enough in either direction. I just had a patient last week who was rear-ended by a truck on the freeway who now has an intermittent esotropia. He reported never having an eye turn or lazy eye as a child, and he wasn't suppressing his eye turn, his eye that turned in my exam, which he probably would if he had this problem since childhood, as the brain would learn to ignore one eye. And when I now showed him his numbers and my findings, he chuckled and said that just the other day, his daughter asked him where he was looking because one of his eyes wasn't looking at her. He laughed in the exam room because he said that his daughter was a jokester, so he didn't take her seriously and thought that she was just messing with him. So do you think that he told his attorney that he now has a lazy eye? No, of course not. This was completely missed by everyone until he had a detailed visual processing evaluation with me, a neuro optometrist. So hopefully this video helps you understand the true cause of an eye turn or lazy eye, because understanding the cause now helps us see that a brain injury absolutely can cause an eye turn or lazy eye, which is honestly catastrophic to one's quality of life. When this happens, patients will occasionally get double vision, occasionally moving and bouncing of words, decreased reading comprehension, decreased depth perception, eye strain, headaches, motion sickness, car sickness, light sensitivity, difficulty working on computer screens, brain fog, fatigue earlier in the day, and definitely makes them now more susceptible to tripping and falling and sustaining another injury. My biggest cringe is that the majority of my post-concussion patients that come to me come after sustaining their third, fourth, or fifth injury. Another patient of mine who came in, who was also rear-ended on the freeway, presented to my first exam with horrific bruising along the side of her face because just a couple days before the exam, she fell walking down the stairs. She was unaware that she was actually getting vertical double vision from her first concussion, and that absolutely made her more susceptible to tripping and falling. And now she has come to me after suffering 2 injuries, the second of which, in my opinion, should have been completely avoided had she sought visual processing rehabilitation sooner. So again, I really hope this helps to better understand the cause of an eye turn, because now, of course, we can see that brain injuries can cause eye turns and the list of horrific symptoms and decreased quality of life that comes with them. Thank you so much for your time and viewing this video and truly taking the time to expand your knowledge on the complexities of the visual processing system so that you can better identify the signs and symptoms of these deficiencies and provide your clients with care that most people, including many clinicians and other professionals, completely overlook and miss. As always, you can reach out to me via email at drmccartin@visualprocessinginstitute.com. I often share my personal cell phone number with clinicians and professional colleagues if you email me and if that is an easier form of contact. Thank you again for your time.